Good evening, everyone. Thank you for your patience while we worked on the technology. My name is Joan Shaughnessy. I'm a professor here in the law school and also an affiliate professor in the Shepherd program. So on behalf of the Shepherd program for the interdisciplinary study of poverty and human capability, the Francis Lewis Law Center, and the University Lectures Fund, I welcome you to tonight's lecture by Professor David Super. Before I turn to introducing Professor Super, I've been asked to draw your attention to the next lecture sponsored by the Shepherd program, this time with the Department of Economics in the Johnson Lecture Series. On November 9th at 7:30, Richard Freeman, the Herbert Asherman Professor of Economics at Harvard, will be speaking on a critical topic to all of us. Can the U.S. restore shared prosperity after the financial meltdown? That lecture will be in the Moot Court room across the hall from this room. So watch for that publicity, and hopefully many of you can attend. We are delighted to have Professor David Super with us today. He was educated at Princeton, where he graduated magna cum laude, and at Harvard Law School, where he graduated with honors. From there, he turned to a practice that concerned things dear to his heart. He was with Community Legal Services in Philadelphia. He was with the National Health Law Program, the Food Research Action Center, and the Center on Budget and Policy Priorities. David dug into the places where law and poverty meet over a distinguished career in practice. And then, from my profession's perspective, he took a turn for honoring our profession by becoming a legal academic. He is now Professor of Law at University of Maryland, but he has taught, among other places, at Princeton, Harvard, Yale, Columbia, Georgetown, Howard, Pennsylvania, and first and foremost at Washington and Lee, where he taught as a visitor and an adjunct professor over a period of 6 years. And I can say that David exemplified what we hope for in all our faculty because his students always came first. Our focus on students is why we were able to attract him here, and our students benefited enormously from the work, the care, the skill that he put in to what he did with them over those years. But tonight is more a focus on David's scholarship. And like many fields of academia, lots of good scholarship gets done, but there is frequently a fashion in scholarship as there is in other things. And something will be hot for a while and get lots of attention, and then for no discernible reason, the issue will get dropped from the agenda and something else will come along. One of the things I so admire about David is that his focus has always been laser clear and been the same from the beginning. David's concern has always been the places where law and poverty intersect, and the way the legal regulatory framework either succeeds or fails in alleviating the real problems of real people. And since he has entered academia full-time, David has put poverty and federal legal regulation back on the front covers of the leading academic journals in law. He has published he will be publishing shortly in the Pennsylvania Law Review. He has published in the California Law Review, in the Harvard Law Review, and many other places, always on aspects of this same critical topic. So it is my great pleasure to invite David to the podium to deliver his lecture on the future of poverty in America, recession, healthcare reform, and climate change.
Thank you very much. I no hope whatsoever of living up to that introduction, but I'll do the best I can. Thank you very much. It's been absolutely wonderful the last couple of days being back at WNL, a place where I have wonderful experiences thanks to terrific colleagues and fabulous, dedicated and stimulating students, and it's a great honor to be back here and very, very happy to be giving this lecture. I'm frankly surprised at the turnout because as I said I was going to talk about such diminutive topics, I would think you would have thought I would tie it all up in 3 or 4 minutes and be done. But I will try to find something to talk about between the recession and healthcare and climate change to occupy at least a respectable amount of time. I was asked to talk about something that is relevant to my expertise and that might be of interest to people. And I think where this country is going with respect to poverty is one of the most important questions that I'm interested in and care about, and that I would like to think that all of us would think is an important matter. And so this seems like at a time when poverty is rising rapidly and when Congress is considering not 1 but 2, potentially 3 major initiatives that could have a great deal to do with the situation of the poor and the number and severity of the difficulty of the poor over years to come, that this would be a good time to take stock and think about where we're going with respect to poverty. To do that, I want to step back a little bit and offer a little bit of historical perspective, and then I will rapidly get up to date. I want to start with the recession of 1990-91. Poverty is both a chronic and an acute problem. Poverty is significant and substantial in any year, but it gets worse, both in its depth and in its numbers in the case of a recession. So if one is interested in studying poverty, it's worth studying recessions. The recession of 1990-91, while nowhere near as severe as the current one, is still, I think, instructive in some respects because it's the last time we had a recession under a system that we saw fit to abandon. Although the recession was over in early 1991, unemployment climbed through June of 92 and subsided only slowly thereafter. Poverty climbed through 1993, and participation in food stamps, which is limited to people with incomes below the poverty line, peaked in March of 1994. The cash assistance rolls through the then program Aid to Families with Dependent Children, as well as food stamps, swelled to fill some of the gap in people's income caused by the recession. By no means all or even most of it, but they were there and they expanded dramatically to reflect the much greater number of people that were poor. And in addition, the fact that even people who had been poor previously had been able to get by with the help of relatives, their relatives were now hurting, and perhaps the informal assistance networks were deteriorating. Unemployment insurance also grew, as you would imagine, during a recession, although it grew less than one might wish or one might hope, because our unemployment system was designed in the 1950s to deal with a very different kind of assumption about worker than we have today. It was essentially, if you think of it as an auto workers system, people who work full-time at fairly good paying jobs year-round, and then may lose out when there's a recession and production is cut back for whatever reason. In the current environment, where people move from job to job, where people are in the service sector, where people are often piecing together part-time jobs, where people may be partially self-employed some of the time, work for small employers in and out of government, and so on, there are more and more people who are not covered by the unemployment system. The fraction of the unemployed drawing or eligible to draw unemployment benefits has steadily shrunk with each recession since at least the early 1970s and continues to go down. In addition, while cash assistance and food stamps were fully responsive, the unemployment program already was not. Persistently high caseloads in cash assistance and food stamps resulting from the hangover of the recession is something that's happened with every recession up to this point in the country, is that people stay on these programs even after nominally the recession is over, because it takes a while for the lower skilled people to find jobs again. That these high caseloads contributed in large part to the passage of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, widely referred to as welfare reform. The PROWARA did three things, and they're often either lumped together or one of them just ignored. And I think this is an occasion when it's, the current situation is an occasion when it's worth picking these things apart, because one can reasonably like some of them and not like others. First, it replaced the Aid to Families with Dependent Children, which was an open-ended federal matching program that would provide assistance to anyone who qualified, and the states would, the federal government would match between 50 and 80% of the state's costs of those benefits, with the TANF, Temporary Assistance for Needy Families, block grant, which was a set clump of money that states got, and if they needed more, they didn't get it. If they needed less, they still got it. It did not vary at all with need. Second, it imposed behavioral requirements on recipients, requiring to look for work, time limits, a host of other things varying considerably from state to state around the country. That's what I think most people think of when they think of welfare reform, the behavioral requirements, the notion that the prior program did not have enough strings and the new one did. And the third thing, which is often I think completely forgotten, is that it cut food stamp benefits by almost 1/5 by the time it was fully implemented, not to people who were not working or violating some other behavioral requirements. That was less than 3% of the cuts, but primarily through big across-the-board cuts, changing the programs, making the program less responsive to inflation and unemployment and so on. The initial results of PROWARA were studied, and at least the political establishment and the news media widely regarded the results as being very favorable when looked at after the first 3-4 years of implementation of PROWARA, and perhaps of some state initiatives that had preceded PROWARA by a few years. The results, as widely understood, were shrinking caseloads, increased employment for the single parents, single mothers, and that was well known. What is less well known is that states also, as the caseloads were shrinking, and as frankly demand for the program was shrinking because the economy was booming, poverty was down, is they started diverting money from TANF to other things. Some of it perfectly natural things like child care subsidies for low-wage workers, but some of the things that had absolutely nothing to do with anything. TANF in various states helped pay for the highway budget, the corrections budget, tax cuts, marinas, and other important things, I'm sure, but not exactly related to poverty. And it ended up being sort of a situation where if your state wasn't diverting TANF money to things unrelated to poverty, then you must have a really dumb fiscal officer, because it just wasn't all that hard. Obviously, there were states that didn't do it for honorable and moral reasons, and I don't need to cast aspersions on them. But certainly in Virginia, TANF funds were diverted to a very wide range of programs that allowed the state to withdraw general fund dollars from them, give them TANF money, and spend the general fund dollars on tax cuts or on other initiatives that this or that governor or legislator thought was worthy. What was unfortunate about the studies and about the conventional wisdom about the 96 law is that the studies were done at a time of rapidly falling poverty and record low unemployment. So we're studying a program when it isn't particularly needed. That's like saying that the federal deposit insurance worked very well during a boom. Well, yes, of course it did. Or that the banking regulation worked very well during the mid 2000s. Well, I suppose you can say it did. It turns out that when they were really needed, they worked much less well. And TANF, it turned out, was the same thing. The recession of 2001 was a relatively mild recession, one of the mildest recessions we've had since World War II, and it therefore didn't provide a full test. But one curious thing is, as poverty was rising throughout that recession, TANF caseloads, cash assistance caseloads, continued to fall. The fraction of low-income families that were getting any assistance from the cash assistance program was falling actually quite sharply during this period because poverty was going up and caseloads were going down. The story that had been told during the boom of the 1990s that people were moving from welfare to work was clearly not true. Unemployment was way up, and yet caseloads were down. And what that meant was that we were providing less and less assistance to people. And unfortunately, just as this was happening, research into TANF largely stopped. The Bush administration diverted the funds that had been spent studying TANF to studying other priorities, marriage promotion programs, absence education, things of that nature. And I do not by any means mean to suggest that this was part of some cover-up, to the extent that that research might have been embarrassing. It wouldn't have been embarrassing to the Bush administration. So I don't think that there was any deep, dark conspiracy involved. I think they had these other agenda items that they wanted studied that hadn't been studied much, and they took the research funds over to that. But that does mean we don't know much. We have very thin information about what happened to the families who were not getting cash assistance but were poor and had faced a very rough job market in 2001 and in the years that were following that. So that ought to have alarmed us, and some of us, I think it did alarm, but we didn't have the research. We didn't know what there was to be said, and when Congress returned to welfare policy in the Deficit Reduction Act of 2005, which of course was not passed in 2005, but details, Congress in fact simply stayed the course, or indeed ramped up the pressure on states to shrink their cash assistance caseloads and treated what had been learned in the boom years of the 90s as all that we needed to know about what to do on poverty policy. Well, fast forward to 2008. 2008, on paper, was the beginning of the current recession. In practical terms, and it was a recession, I don't mean to be trivializing that, but conditions in 2008 were much, 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 much better than they are now or than they're likely to be next year. So although this is a recession year, it is relatively modest. Unemployment currently is almost 10%, well over 9%. It's been over 9% for a while, and I don't know of a single serious economist who doesn't think it's going to break 10% and soon. Unemployment last year averaged only 5.8%, so we're talking about a much, much milder case of economic illness than what we have now. Yet in 2008, the poverty rate was 13.2%, the highest since, or roughly equivalent to, 1997, the year after the 96 welfare law passed. So poverty was back to almost to where it was when we passed the '96 welfare law. The poverty population grew by 2.6 million people. It's now almost 40 million people in poverty. And we had the biggest drop in median income, real median income adjusted for inflation, on record. How did public programs respond? Well, here the story really diverges. Unemployment compensation, again, covered a shrinking, a still smaller fraction of the unemployed, but it did increase a great deal, as one would imagine, when unemployment was going up. But TANF and food stamps, now referred to as the Supplemental Nutrition Assistance Program, SNAP. I cannot get used to that name. It will be food stamps for the remainder of this lecture. The food stamp program responded very, very aggressively because food stamps, despite the cuts in benefit levels made in the '96 welfare law, is still a responsive entitlement. It still will serve anyone who qualifies, anyone who meets the eligibility criteria. So the food stamp benefits now are 25% higher than they were when at the peak of the 1991 recession, just over the last year, or from July of '08 to July of '09. We've added 6.8 million people, or up 23% of the food stamp rolls, and we now have almost 36 million people receiving food assistance benefits. This is cushioning the impact of the recession on real families. It's also keeping demand up. It's stimulating the economy because people are spending the food stamps at grocery stores, which are paying clerks who are going out and buying other stuff, who are giving money to people. So it is keeping some money flowing through the economy. By no means enough to offset what's happening in the recession, but the economy would be in worse shape if it were not for this stimulus. By contrast, the TANF program, Temporary Assistance for Needy Families, is asleep. The TANF program caseloads have been basically flat, or even basically flat. In December 2005, TANF was serving 4.9 million. It dropped in December 2006 to 4.3 million, 4.0 million in 07, and 4.0 up to 4.2 million, a trivial increase by December 2008. Only about half the states have had either declining or flat caseloads that have not responded to the recession at all. And indeed, even through March of '09, most states were not allowing additional people in any significant numbers onto TANF. And at the same time that food stamps is increasing by almost a quarter in a short period of time, only 5 states for which we have data increased their TANF caseloads by 15%: New Hampshire, New Mexico, Oregon, South Carolina, and Washington. What unites those states? I haven't a clue. The result of this is that this pattern is the result of several things. It's a result of states competing over the period since the early to mid-90s for caseload reduction. How many people can you put off of cash assistance roles? Your effectiveness in fighting dependency is measured by your caseload reduction, and so states are loath to allow their caseloads to rise. The law imposes severe financial penalties on states that don't have their caseloads dropping unless they're able to jump through some extremely exotic administrative hoops that few have been able to figure out how to manage. States, as a result, have discouraged people from getting on assistance, have time-limited people, have made enrollment exceedingly difficult. And so we have a program that is supposedly our first line of defense against poverty at a time when poverty is rising rapidly, that is doing nothing. By contrast, at the peak of the caseload increase in response to the 1991 recession. There were 14.3 million people, more than 3 times as many people getting cash welfare as there are now in a much more severe recession, with what is surely, when the 2009 data comes available, going to turn out to be deeper poverty. But it's actually, it may well get worse, because states are facing severe budget crises. At least 48 of them are in trouble. If you live in the Northern Plains, there may be a little bit of hope for you if the oil revenues are strong. But otherwise, 48 states are in trouble. They finished their budgets for the most part for the current fiscal year, and yet they've now discovered a total of $28 billion in additional shortfalls for the upcoming year. The shortfalls are estimated at $180 billion. And that estimate, I suspect, will rise. They've already closed shortfalls in this last year of close to $170 billion. And this has resulted in huge cuts at a time when people are vulnerable and can afford to absorb the cuts least. Healthcare has been cut in 27 states, service to the elderly and disabled in 24, K-12 education in 25 states, higher ed in 34 states, and so on and so on. And a number of states have been, at a time when TANF money is needed to assist the newly poor or the newly in deep poverty, have been shifting TANF money in the other direction, and have continued to use TANF funds to support the rest of their budget as that goes into distress. These are cuts, again, that people can absorb least well at this time. Their friends who might have helped them in other periods are themselves in distress and less able to help out. Private charity is in less of a good position. Those that are dependent on donations are seeing often, not across the board, and in many circumstances, that those are drying up as people lose jobs. Those that had endowments have seen the endowments tank with the stock market. Those that had their endowments invested with Mr. Madoff had other problems. And the private charitable sector's ability to fill this gap has shrunk. People's informal networks' ability to fill the gap has shrunk. And on top of all of this, all of these budget cuts mean less spending in the economy. When you cut back on health care, it means that doctors lay off their staff, a junior doctor, a nurse, a technician, a receptionist, or whatever. Those people are spending less money. Those people can't make their mortgage payments and go into foreclosure, and so on. So all of these cutbacks in state funding are both directly impacting low-income people and serving as a further drag on the economy. Economists generally, the accepted notion since, I'm not an economist, but the notion accepted by a great many economists, shall we say, has been that when the economy goes into recession, the government may need to prime the pump to stimulate it, and when the economy is booming, the government should run surpluses to keep it from overheating and to make up for the deficits run during recessions. The states are doing exactly the wrong thing in that regard. They're making cuts at a time when the economy is extremely fragile, and those cuts are exacerbating the problem. We did pass a stimulus bill earlier this year, which is, by the way, completely separate from the bank bailout legislation that was passed last year, but which in the public eye often the two get conflated. I am not here to sing the praises of the bank bailout bill by any means, but I do think we should recognize the stimulus bill, and it did a few things that are, I think, worthy of note from a perspective of caring about poverty. One is it filled about 40% or so of the fiscal gap, maybe a little less, that states experienced. So it lessened the cuts that states made to basic assistance programs, child care subsidies, health care programs, and so on, would have been significantly more severe had it not been for the stimulus money coming in, covering 40% of the gaps in last fiscal year and the one that we're in right now. That share will fall to only about 20% of the gap next year. This is with It's also, by estimates of my former organization, which looks sound to me, kept about 6.2 million people from falling into poverty. So the poverty rate, in other words, might well be about 1/6, 1/7 again higher if it were not for a combination of tax credits and additional assistance, food assistance, and one-time payments to the elderly and veterans and people with disability and some various other provisions. It's also provided $5 million to the TANF program to check the caseload decline, to limit caseload decline for people who are poor. Not that we are falling back in love with cash assistance, but to respond to the fact that there are a lot more poor people right now, and that states don't have the additional money to assist them. It's also modestly increased funding for food stamps. And the irony of the stimulus bill is that the provisions that have been working, the ones that put money out the door rapidly in aid to families with the TANF program, or in additional food stamp benefits, or in tax credits for the working poor, and so on, those have been out there stimulating the economy. Those parts of the bill were the ones that were most criticized. The public works project, which everyone had a love in, do I hear the word pork barrel? No. Nasty thought. Have been slow, which is traditional because figuring out what you want to do, getting the architectural designs, which don't take a lot of people, doing the contracting, which that stuff is very slow. Actually getting people employed in building whatever it is, or tearing down whatever it is, or whatever you want to do, ends up being the part where you get a lot of jobs, ends up being a long way down the road. Yet those were the things that were seen as real and substantial and were kept. And when moderate Republicans and the administration negotiated to shrink the bill, aid to the states, which kept the states from deepening the recession with their budget cuts, and direct aid to low-income families were among the things that were cut most from the bill and that were weakened the most. So where does this leave us? Well, I think this leaves us with some valuable lessons. There's, I think, still a very wide consensus in favor of one part of the '96 welfare law, which is behavioral requirements on low-income people. Exactly what they should be, exactly what the details should be, under what circumstances, that may be controversial. But the notion that people who get a check should be subject to substantial conditions and expectations still, I think, has wide support with the public and across the political spectrum. On the other hand, the other two big aspects of, or two of the other big aspects of the '96 law, the change in the structure of cash assistance and the cuts in food stamps, I think aren't looking very good. At a time when unemployment is working less and less well with every year as it becomes farther and farther out of touch with the current structure of the workforce, and at a time when cash assistance isn't really helping with meeting the increased needs in the recession much at all, food stamps has been the only big, reliable program that has increased, not quite proportionately with the increase in need, but pretty close. And the cuts in food stamps that have nothing to do with need or compliance with any behavioral expectations are not making a lot of sense. And the turning TANF into a block grant to states, so states get a flat amount of money and it is not dependent upon how much they're doing to help low-income people, and it becomes a piggy bank that gets raided by all sorts of other programs in the state budget, that's looking pretty foolish. In the late 90s, frankly, we wasted a ton of money on this as states took the money off into other places, and right now we need a lot more money. The government has come up with $5 billion in this emergency contingency fund for TANF. That money certainly could have been completely financed and then some if we hadn't wasted all that money in TANF, letting the states spend it any way they want in boom years of the 1990s. When they didn't need it, we should have taken it back. But we didn't do that. And the notion that we treat TANF, we treat spending on poverty as something that's constant in good times or in bad, never made any sense economically, and I think practical experience is showing that it does not indeed make any sense. The TANF program is up for reauthorization, and I hope that while it will certainly not move back towards the prior Aid to Families with Dependent Children program, I hope we will take this as a lesson that we need to make more money available in recessions, and by the way, we need to sop the money back up in booms to control the federal deficit and to keep the states from spending it foolishly as they did in the late 90s. We therefore need to separate the structural and behavioral components of the '96 welfare law and pull them apart separately. We also need to be prepared for, and people who are concerned about poverty need to speak up, be ready to speak up about the fact that poverty and unemployment and usage of these programs is likely to stay quite high for quite a number of years to come. That these programs are, that food stamp usage peaked 3 years after the official end of the recession of 1990-91, and if it follows that form now, and if, as everyone seems to be saying, the current recession is formally ended, then that suggests that food stamp usage may peak sometime in 2012. Something else is scheduled to happen in 2012, I think. That it is likely, as it did in the mid-90s, to come in for criticism, but that this is unfounded, that food stamps and poverty generally is often both a leading and particularly a trailing indicator of the overall health of the economy. And it's pretty easy to think about how that would be. When the economy is bad, when it's in recession, people take jobs for which they're overqualified. Someone takes a job that requires less skill, less education than they have. The employers are happy to grab first-rate talent for second-rate wages, and this then pushes people down the job ladder, and the people at the very bottom get pushed completely out. And a lot of people who employers were willing to settle for as workers in a tight job market in the late 90s, employers have no need to employ and will consistently not employ when they have overqualified people that have been displaced from better jobs in the workforce. And until the people who have moved down to jobs they're overqualified for get out there and find new jobs in a newly recovering economy that are better, the people at the bottom are continuing to be squeezed, and poverty will rise, and the programs will rise. That's not a defect in the program. That's not them being out of control. That's the way it works in the countries coming out of a recession, particularly coming out slowly, as it appears that we will be doing. So I hope we will learn about the importance of programs responding to need in that manner. But we have two new challenges. In addition to the reauthorization and I hope partial restructuring of welfare programs, we have two new initiatives which have enormous potential, both positive and negative, to affect poverty. One of those is healthcare reform. Now, it is true that most, not all, but the vast majority of children under the poverty line are eligible for Medicaid. However, Medicaid eligibility for their parents in most states cuts off well below the poverty line, so there are lots of poor parents that are not covered. And for single or other childless adults that don't have disabilities and are not elderly, Medicaid is generally not there at all, no matter how poor they are. So there's an enormous extent of uninsuredness out there, people not covered by Medicaid. In census figures for 2008, again, before the recession really reached its full force, we saw an increase of 682,000 in the number of uninsured people, making over 46 million uninsured. The Congressional Budget Office projects this will rise to 54 million uninsured within the next 10 years. And the uninsured rate is now 15.4%, just a few years ago, in 2001, it was 14.1. This is increasing rapidly, and it's increasing particularly among middle-income families. The sharpest increase between families making $25,000 to $50,000, and also a sharp increase in families making between $50,000 and $75,000 a year. Medicaid is actually expanding, and to a vastly lesser extent Medicare, but employer-sponsored health care health coverage is dropping sharply and is expected to continue to drop. So meeting this need with health care reform is certainly an important thing, and there's certainly all sorts of indications that low-income people, because they are low-skilled people, who tend to go together, are extremely vulnerable in their employment and the rest of their family security to illness. If they have an illness that is untreated, they miss a number of days for work, the employer says, don't bother coming back, I'll hire someone else, your skills aren't that hard to replace. If I get sick, my dean does not have an extra evidence professor lying around, so they're kind of stuck with me. But that's not true for low-income and low-skilled people. So the notion of health care being tied in with employment policy, with people's employability, is very clear. People's kids getting sick cause them to miss work, which causes them to get fired, and so on. So from a broader policy perspective, as well as health care by itself is a worthy enough concern, there is a great deal of need and importance about this. That being said, however, the way in which one addresses this problem makes a very big difference, and there are some real concerns about the way the legislation is moving through Congress. What I am not interested in talking about, what I do not propose to talk about, is the much discussed, much misunderstood, public option. That's not what I'm talking about. Healthcare reform and public healthcare programs are about two quite different functions. One is financing healthcare, and the other is organizing or delivering it. The public option is a way of delivering healthcare in competition with private health plans. That's not my agenda here. I want to talk about financing it, about its affordability. All of the major bills, the Senate Finance Committee bill, the Senate Labor Committee bill, and the House bills would require people to have health insurance, and would provide subsidies to help them purchase that health insurance. These subsidies vary, however, considerably among the programs, and what they would cover varies considerably. The Senate Finance Committee bill, which is widely, I hope not altogether correctly, seen as being a harbinger of what the final legislation will be, would require people to pay very large fractions of their income for health coverage between premiums and co-payments. Exactly how extensive this health coverage will be, exactly what the plans will cost, is a difficult thing to predict, and whether there's a public option competing to cull down costs is certainly part of the story there. But it leaves people with the potential for paying very large chunks of their income for plans that may not cover them terribly well at all. If that happens, then all of the other necessities that people are trying to meet will take a big hit, which many families won't be able to handle, and in addition, although they will no longer be counted as uninsured, there may be a lot of people who can't afford the co-payments and so on to go to the doctor, and so they've got a nice little card in their pocket, but they're still not getting the kind of health care that we assume people need. And just to show how much the differences, which are, yes, mind-bogglingly complicated among the various bills, matter. For families between 133% of the poverty line and twice the poverty line, the Senate Finance Committee bill would require them to pay between 2 and 4 times as much of their income as the Senate Finance Committee bill, which is, again, regarded as being a likely predictor of what's happening. As health care affordability declines, we may be shoving the problem of uninsuredness under the table, and pretending that by having people a card in their pocket that they will be in good shape. In addition, there's a lot of concern about the impact of employment that some of these approaches, well, that the Senate Finance Committee approach would have. It would apparently require employers, many employers that hire low and moderate income people to pay surcharge of up to $4,000 per year if they don't provide health care coverage for each worker who works 30 hours, low-wage worker who works 30 hours per week. Now, it doesn't take a very sophisticated economist to figure out what that's going to mean. It's going to mean that employers, if given a choice between automating and hiring low-skilled workers, will be more inclined to automate. If given a choice between hiring two relatively low-skilled, low-paid workers to do a job or one rather high-skilled worker to do the job, they'll hire the high-skilled worker. And that they will do what so many employers already do, but with more of a vengeance, is make sure that people's hours never reach 30 so that they aren't subject to this fee. And low-income people, in addition to dealing with very low hourly wages, will have a great difficulty getting enough hours of work to support themselves and their families. In addition, because of the way this thing is structured, and I really will not inflict the details on you because that would be mean, the surcharge employers pay will be greater, could be greater, for families with children. So the very people who the 96 welfare law said ought to go to work and get to work, we will be charging the employers if they hire them. Part of me thinks that may not make perfectly good sense. I need to ponder that. The policy coherence here is a problem. In addition, the subsidies are, while relatively substantial for people right at the poverty line, phase out fairly rapidly. This is for people whose income is rising between 100 and 200% of the poverty rate. That's the same income range at which people are starting to pay federal and state income tax, and at which the earned income tax credit that goes to low-income working families is phased out. The end and at the bottom of that range in which food stamps are phased out. So there is certainly the possibility that families will be facing an effective tax rate, that they are, for every additional dollar they earn, their take-home will be shrunk by the phase-out of the health care subsidies, the earned income tax credit, federal tax, state tax, perhaps child care subsidies being phased out by a percentage that exceeds that at which each additional dollar that Bill Gates earns is reduced by taxes. And why we think that Bill Gates needs stronger work incentives than low-income families, again, is a difficult thing to understand. I don't think the Senate Finance Committee means, or the other people involved with this mean, to tax low-income people at a rate higher than Bill Gates, but it certainly is an example of a policy that has not been carefully thought through. Finally, and I don't mean to go into this in great detail, but want to highlight the point, is the climate change bill, which I'm sure may have looked like an odd throw-in on my program or my agenda today. But the main focus of climate change legislation or carbon emissions regulation legislation is to increase the cost of carbon so that we will consume less of it, an absolutely essential, urgent, necessary thing to do. But if you increase the cost of something, that will have an impact on the people that buy it. And as it turns out, a higher fraction of low-income people's income goes for carbon, not just for fuels, but they pay a very high fraction of their incomes for heat, carbon. They pay a high fraction of their incomes for food, which gets transported and uses up a lot of energy getting from the vineyards and fields of California to your table. On carbon, that the overall impact of an increase in carbon costs will be sharper on low-income people than others. The House bill makes some efforts, some very modest efforts, to provide assistance to low-income people in this area. Much of what it does, however, under the guise of helping low-income people, is gives money to electric companies. Now, most low-income people that I represented when I was in field did not own electric companies. I don't remember a single one that did. The idea here is that the electric companies will somehow give people price breaks. This is an argument that apparently people take rather seriously, and as you will see, I'm having a little difficulty in that enterprise, because electric companies don't know people's income. Most people aren't really eager to tell the electric company their income as a matter of general privacy, and because the electric company will often be bringing up collection action against them, you don't usually tell people who might be suing you all about your personal finances, your personal details. And if the electric companies were to somehow moderate their rates, and it's not clear how we would even monitor or measure whether they had done that, then that completely defeats the whole, their rates across the board, that completely defeats the whole purpose of the climate change legislation, which is to increase prices to cause people to substitute into energy efficient homes or energy efficient means of transportation and so on. I am by no means suggesting that climate change legislation should not move forward or that we should be hostile to it, but if we are making what is not really a general price increase, but a general shift in the price structure away from gasoline and other relatively inefficient uses of energy towards other kinds of things that will also create jobs, that will also function in the economy, if we are restructuring things in that way and we don't address the impact on low-income people, then we could, in legislation, this important, necessary legislation, significantly increase poverty, the depth of poverty, and the difficulty that low-income people face in making ends meet. So that is the story of where poverty is going in the future, which is to say, of course, we don't know. There certainly is a lot of potential if we get the climate change and healthcare legislation right, and we learn from the lessons of the current recession that people in the future will be much better protected than they have been in the last few years, but there certainly is potential in the other direction as well. I'd be pleased to take any questions that people might have. Thank you.
One thing you didn't mention is that, I don't think you mentioned, is that Medicaid will be raised to 133% of poverty and categorical eligibility will be removed. So if we're looking for one brief, little glimmer of light, there is that.
Thank you. There is in the pending proposals significant expansion of Medicaid, although I have to say, and I didn't do that in the interest of time, the story in Medicaid is a little complicated as well, because following the structural changes we made in '96, where we gave states almost complete control over cash assistance programs, we did something not nearly that extreme, but substantial in the Deficit Reduction Act of 2005, which passed, of course, in 2006, in allowing states great control over Medicaid. And I think it is unclear what a Medicaid expansion will mean in the long term if people are dependent on Medicaid and states are continuing to be under fiscal pressure and may be looking for ways, which are now quite easy, of cutting Medicaid back. Whether Medicaid expansion is all that it would have meant in prior years, now that states have such enormous authority to weaken Medicaid and are under such enormous fiscal pressure to do so, I don't know. Other?
Why is the employer surcharge likely to disproportionately disadvantage families with children?
Because it is based on the amount. The employer would be surcharged. The formula is sort of a mess here, so forgive me for oversimplifying, but they would be charged the national average subsidy for premiums and the national average subsidy for co-payments for low-income workers. And the cost of a plan for a single person is much, much less, and hence the subsidy is much, much less than for a family with kids. So if an employer hires a single person, they may pay a few $100s because that's the amount of public subsidies that person is getting for just their own coverage. But if they hire a parent with a bunch of kids, they could end up paying thousands of dollars because that family is getting more subsidies. It's an effort to collect back from the employer the public subsidies we're getting, but in the course of doing so, it makes the employment of vulnerable people who have a rough time in the employment market as it is much rougher.
Maybe
Sorry, a little bit more on the free rider provision in the finance bill legislation. But
Yes.
Is there a movement? Because I mean, as Recline, it's been very, very much out in the public domain. What is going on with that provision? Is there a movement to reduce that burden?
So far, the movement's in the other direction, and in the Senator Baucus's original proposal, his bill had that provision in it, and in two respects during the markup, they increased the severity of those penalties or those surcharges on employers that hire low-income workers. So it was, at least by the senators on the committee, regarded as not only acceptable but a nice place to get money for doing other things they wanted to do with the bill. So it is, I think, something that one would imagine that the Labor Committee wouldn't like and that the House committees wouldn't like, but it brings in a significant amount of money to pay for the bill, and finding a way of replacing that money in the bill that doesn't get other people politically very upset will not be an easy thing. I mean, that's the problem with this whole process, is that you have so many groups on the right, on the left, and folks that are not easily categorized, placing this, that, or the other source of savings, be it revenues or spending cuts, off the table. You end up having a very small universe, and it becomes then very difficult to say, well, this is unacceptable, you need to fix it, be it the very low subsidies for families just above the poverty line that's going to cause them to pay huge fractions of their income for health insurance, or provisions like the employer, the penalty for hiring low-wage workers. People are not going to say, oh, it's a bad idea, let's drop it, because they have to find some other way of paying for it, and most of the options, easy options, have been taken off the table.
What do you think the prospects are for the public health care option, and if it actually does happen, how would that work?
The public option is, in essence, a plan that would be run by the government. The details of how it would operate vary from proposal to proposal. And the idea is that people, if they didn't like the deals that were being offered by Blue Cross or Prudential or whoever, would be able to buy a health care plan from the government instead. This would not directly affect the subsidy issues that I'm talking about here. What I think the indirect effect, which could end up being an important one, is keeping the price of plans from going very high. In a lot of states, not all, but a lot of states, there are very few plans, very few companies have a whopping share of the market, and the notion of market competition is largely a myth. And in those places, as well as others where there may be a few more plans, but they aren't very actively competing against one another, you would have a government plan that does not have any incentive in keeping prices up that would be competing, and it would mean that people who are having to purchase plans on their own because their employer doesn't offer it would have a more economical plan. So it wouldn't directly affect the subsidies, but if what you're buying is less, then you have less money left over after purchasing it and the subsidies. So,
Do you think it's going to pass?
I think it's. I think we're in a situation where there are so many people dug in on it that something that is at least arguably a public option will pass. And whether it ends up getting dressed up with a different name or whether it's attached to some sort of a condition, I think is unclear. But I think it's got to the point where a lot of members in the House would have trouble voting for a bill that doesn't have a public option, and that some sort of very complicated negotiation is likely in conflict. I think the Senate will pass a bill without the public option initially, but what happens at the end of the day, I think, is that some version of that may well come in. There are others in the room that would know better than I.
I have a question in terms of chronic poverty. If you look at the issues, structural versus personal, and by personal I mean addiction, mental illness, single parent, those arguments. I'm just curious, I realize that you purposely focused on the structural, but I'm curious what you think about the personal issues, like if you think that those issues are as important as the structural causes, or the personal causes, just how they relate to each other, whether they should be focused on, dealing with mental illness as much as the structural causes of poverty.
I think it's a great question, and something that I think was lost in the '96 welfare law and the state initiatives that preceded it is a willingness to look at people as individuals. We became very disenchanted with the whole notion of government officials making any individualized judgment. We assumed that they were categorical softies and that we needed hard, firm rules to do that, and we needed a steady progression downward in caseloads, or else the states were fooling around. In the course of doing that, we effectively ruled out individualized attention to people. And so someone who is not working because there's some first-rate stuff on television that they'd rather watch, and someone who's not working because their kid is on a ventilator and they can't possibly find childcare for it, get treated exactly the same. They're just statistics. They're just bodies into the calculation of the work rate. And so I think dealing with some of what we've learned, what maybe we should have learned in the recession of 2001 but didn't for a lack of research and because it was a relatively mild recession, but we certainly ought to be able to learn in the current severe recession that not everyone is in the same position, that we need to look at people individually, and that simplistic, hard and fast rules are not a very reliable way of addressing these problems, will lead to a greater flexibility for the people that have the barriers to employment that you talk about. I should also say greater attention to some of these fiscal issues, which are, I know, kind of boring and sound technical, is also quite pivotal, because the availability, for example, of substance abuse treatment is extraordinarily limited. And if ever there were anything that you would think it's nuts to have a waiting list for, that would be substance abuse treatment. If anyone who's ever worked with someone who has substance abuse, if you get them in the moment where they're willing to accept treatment, that moment will not last 9 months till they work their way up the top of the waiting list. And yet, among the things that states have been cutting back in the current fiscal climate, they don't have a lot of choice, have been mental health programs, substance abuse treatment programs, and so on. So I think these things actually link up more than it might seem. And I did not mean to be neglecting those. I think in some sense I'm indirectly talking about them, but you're right to suggest that they deserve direct attention.
You talked about the pre-welfare reform AFDC program where people essentially qualify, and it's state and federal sharing the cost, but however many people qualify in a given state, those people are entitled and
Yes.
can appeal if they're denied. And then post-welfare reform, you're describing the TANF where there's a lump sum to the state.
Yes.
And I'm not sure if I understood, are all of those funds then subject essentially to being rated by states for their more urgent needs if they want to?
Yes.
So that it doesn't matter if a person would qualify if they don't meet certain requirements or they exceed the time requirements. then there's no, that's it. There's no, is it because there's no federal-state sharing that we end up with, I mean, people are completely vulnerable to the other needs, you know, the police department or whoever wants funds. That's always going to come first.
Yeah.
So that's essential. There's no limitation on that?
There are three issues here that are all bound up together, that all spring out of the 96 legislation and that contribute to this. One is that there's no federal match for increased spending. So if the state wanted, you've got a state that's trying to do the right thing and says there's greater need, we ought to meet that, they're bearing that burden all on their own. Washington State, South Carolina, New Hampshire, New Mexico, those states are all bearing the burden on their own without any extra federal funding. Every state practically is required to balance its budget every year, rain or shine, and so the states revenues drop enormously in recession. So the states are not, even in the old system, states would often cut assistance during a recession because they couldn't come up with their share, but now they have to come up with the whole thing. So that's part of the problem. A second part of the problem is that the money is so easily rateable. When I taught a course in public welfare law at this law school, we did an exercise where I just put a problem up, gave them a few numbers and said, okay, look at this law and figure out how to steal the money for this completely different purpose. And my students, who as far as I could tell had no particular accounting background, in about 10 minutes found 6 ways to steal the money, 6 ways to siphon the money out. It just wasn't all that hard. So I was really not kidding when I said if your finance director can't figure out how to spend TANF money for police or highways or corrections or tax cuts or marinas, you need a new finance director. Yours is no good.
I thought Clinton tried to prevent that with maintenance fund requirements.
Yes.
They don't work?
You can steal those too.
Okay.
You can steal those too. Yes, states are required to put up 75 or 80% of the amount that they used to be spending on certain programs, but they have to put up this money spent on quote-unquote qualifying activities, and it turns out if your finance director is worth beans, they can find a way of carrying the money out elsewhere. You could, just to give a simple example without going into the technical stuff, you could decide to take all general fund monies out of kindergarten and fund kindergarten throughout the whole state with TANF, block grant, and maintenance of effort dollars, freeing up all the general fund money you were spending on kindergarten for highways, marinas, tax cuts, whatever you like. So those two factors. And then the third factor is that states are not required to serve anybody with cash assistance. There are some states, I believe, they're spending less than 20% of their block grant on cash assistance. And you could, in theory, do a waiting list. States generally don't because that's sort of politically embarrassing. So they just either discourage applicants or cook up new criteria, new limits on eligibility to get the numbers down to what they're willing to budget. And if you've been working in these programs long enough, you've got a pretty good idea how much this eligibility change will shrink participation and get you close to your budget target. So.
You mentioned that substance abuse and mental health treatment is a topic that needs to be addressed separately because it takes up a lot more time. If you don't mind, I'm going to go ahead and make a plug. We actually have a panel on Friday in Classroom B, which is right next door, where we have one of the leading drug addiction specialists in the nation, Dr. Stuart Finkelstein, coming from California precisely to talk about drug abuse, addiction, and detoxification. And our very own law professor, Eric Luna, will be talking about the legal issues of it. So if you are interested in that, be here Friday at 4 because that is exactly what we'll be addressing.
That sounds terrific. It really does. These issues are absolutely pivotal, and they need to get more attention. One of the most unfortunate things about the way these programs have developed in this country, the anti-poverty programs, is they deal with the generic low-income person, and they don't deal with concerns like that. So to the extent specific problems like that, like child care, the absence of child care programs or subsidies, other things can be addressed. That's extremely important.
I was wondering, what is your actual estimate of the number of Americans who cannot get health care at the time? Because that's different. In the media, we hear 46, 47 million, but I'm sure there are plenty of people that qualify for some type of insurance right now that just aren't getting it. So,
they're actually, those numbers, they're not zero, but they're quite small. The programs, Professor Jost was speaking earlier about eliminating categorical requirements, and I knew what he meant and I nodded, but I should have explained what those are. That poverty alone is not enough to make you eligible for Medicaid. You need to be both poor and in a certain age or health or family configuration arrangement. And that leaves lots and lots of folks that are miles and miles from being able to afford any even crummy health care coverage on their own, are still ineligible for Medicaid, not because they aren't poor enough, but because they don't meet these quote-unquote categorical requirements. So the participation rate is, I mean, as you get to the working poor families, is not 100%, but I think it's pretty good and pretty high from everything I've seen. The biggest problem is people not qualifying. I should say but I do agree with the implication of your comment that the uninsuredness number is not the end of the topic. There is, of course, some health care that is provided on a fee-for-service basis. I mean, you can walk into places and pay the doctor to see you, even if you have no insurance, for a lot of the more complicated kinds of care that people need, and certainly for things like pharmaceuticals, that is not very feasible, but there are some of those uninsured people that are getting some care. Conversely, there are some people with insurance cards in their pocket that cover almost nothing, or that are well insured, but the stuff that ails them is a quote-unquote pre-existing condition, which their health plan won't cover. So the number of people without good or full access to care is greater than the 46 million. And I think over the last several years, the number of people that are nominally insured but don't really have good access to health care has grown quite substantially, but we don't have great ways of measuring that.
Are there any prospects for changing the laws so that it's harder to siphon off money from TANF to other state concerns?
I don't think so. They tried a little bit in the Deficit Reduction Act, and so of the 6 approaches that my students came up with in class here for stealing the money, 3 are now probably not available, but the other 3 work, and you only need 1. So it's very difficult to do it if you're going to keep the notion of a block grant and state flexibility. The problem is if you tell states what to spend it on, as we did in the old law, we said you'll spend it on cash assistance to people that meet these criteria, then that money is very, very difficult to steal. My home state of Pennsylvania found a way, but in general, unless you're really crafty and you're not going to be able to do that. But when you say, well, spend money on whatever you think will help low-income families, that is an invitation for trouble, because we say, well, kindergarten helps low-income families, so we're going to cancel kindergarten. Oh, wait, no, kindergarten was a good thing, so we've taken all our general fund monies out, and we'll pour all of our TANF monies in, and then the general fund monies are available for other things. As long as you don't tell states how to spend the money and use vague definitions, the states can find something they're already paying for that meets the vague definition and swap the money around and then have the money to run with. So I think as long as the block grant structure remains, that opportunity will too.
Are there prospects for changing that on the table, or is that something?
I don't think so. I think it certainly is conceivable that the lesson of the current experience would persuade states that it's not in their interests, but I think I don't see the administration making that a priority, and with everything else that's going on, I suspect that's one controversy that they're not going to wade into.
Well, I know for a fact that Professor Super's day started 12 hours ago, and Professor Beckley met him at the Shared Delivery Inn. So I know this conversation could and should continue for weeks to come among your classes, and I know that David's scholarship will continue to explore these issues, but I think we have to thank him and let him finally relax.